Welcome back. September is National Suicide Awareness Month, and local groups hope that it will raise awareness about the issue and ultimately save lives. According to the Homeland Security Department, suicide is currently ranked 10th for the cause of death among all age groups. And there are some warning signs that you can look out for. They include feeling extreme depression, guilt or shame, feeling hopeless, and talking about or preoccupation with death or suicide. Dr. Laura Landerman Graber is a clinical psychologist. She says the situation is dire, not just for adults, but for kids as well.
Suicide is the second leading cause of death for children between the ages of 10 and 14. So when we say, how big is this? How large is this? I call it an epidemic.
Joining us live to talk about this very important issue is Rachel Reed with Mental Health America here in Terre Haute. Thank you so much for joining us this morning.
Thank you for having me.
So we're talking about suicide. It's a growing problem all over the country, including here in the Valley. How are things looking right now as far as rates locally?
Last year we had 26 deaths by suicide. 23 of those were men, 3 were women. 4 of those deaths were people under 25 years of age. This year we've had 12 deaths, 11 men, 1 woman, and 2 of those were under 20 years old. Dr. Weaver was here this week, and she said statistically Vigo County is 62 out of the 92 counties for suicide. Men have higher rates because they tend to use more lethal options, and we are seeing that as the second leading cause of death for people 10 to 34.
So those rates, what do they tell you about the community right now?
It tells us that suicide is a problem, and it affects everyone. The people who have lost a loved one, you know, our neighbors, our friends, our coworkers, they are suffering, and that is causing issues with their mental health and wellness as well. We know that from the National Institute of Health that family members who have someone lost to suicide are 3 times more likely to attempt suicide themselves. So this is something that we really just need to have open and honest conversations about: mental health, wellness, and suicide.
Yeah, and do you believe that the stigma that's still out there about mental health, do you think that is having an impact on keeping some people from getting the help they need?
So there's still stigma, even though it's getting better. It is difficult to talk about, and people who are in crisis often aren't able to ask for help. And people who have been in crisis before may have had bad experiences in getting care, or don't want to have another hospital stay or go into treatment. Another thing that we see is that people who come to you and they say that, you know, I feel suicidal, I need help, people don't know how to respond. There are classes, programs available like QPR, Question, Persuade, Refer, and Assist, that train community members on how to intervene and respond and keep people safe for now.
Okay. So, I mean, we're already running out of time, believe it or not, but if there's someone out there watching right now and they are suffering, what do you want to say to them?
There's hope. Stay. Please reach out to someone. That bully in your brain is lying to you. You matter. Your life matters. Call 988, reach out to a friend, family member. You don't have to do this alone.
All right, and we have an event coming up this Saturday, correct?
We do, in Perrysville at the park in Vermilion County. Rock the Park with Kindness. It's an awareness event, a prevention event, and at the end we'll have a memorial.
All right, Rachel Reed, thank you so much. The website for Mental Health America, by the way, I have it somewhere in my notes here. It's MHAWCI.org. And, of course, that 988 hotline that's been expanded recently, another great resource. Rachel, thank you for all the work you do, and thank you for being with us this morning.
Thank you so much.
All right, let's head over to Mallory now, who has a look at your forecast.